Hey there, friend. After 30 years of treating patients over 60, there is something I need to share with you. I have watched too many good people suffer heart attacks and strokes in their sleep. People who thought they were healthy. People who had no idea their nighttime habits were slowly killing them. That is why I started this channel, to share what I know. Now, you will notice I use a digital avatar. That is for privacy. But I want you to know I am a real doctor with real experience. Everything I teach is backed by peer-reviewed research. Today, I am showing you 6 evening habits that studies show can harm your heart after 60 and exactly what to do instead. This is educational, not personal medical advice. Always work with your own doctor. Before we get into the habits, I need to explain something important. Why does nighttime matter so much for your heart? Your cardiovascular system runs on a 24-hour clock. During the day, when you are active, your blood pressure is higher, your heart works harder. That is normal. But at night, something crucial should happen. Your blood pressure should drop by about 10 to 20%. Doctors call this nocturnal dipping. Your heart rate slows, your body shifts into repair mode. This nightly rest is protective. It gives your heart and blood vessels time to recover. But here is what the research shows. A major study in the Journal of the American College of Cardiology found that 55% of fatal cardiovascular events in adults over 60 happen between 10 p.m. and 6 a.m. More than half while sleeping. Why? Because certain habits prevent your body from entering that protective rest mode. Your evening routine directly affects whether your heart heals at night or struggles. That is why these 6 habits matter so much. Habit number 1, eating large, heavy meals close to bedtime. I get it. I am not asking you to give that up, but I need you to understand what happens inside your body when you eat a big meal and then lie down. For many families, dinner is the main meal. It is when everyone gathers. It is tradition. When you eat, your digestive system demands blood, lots of it. Your heart has to pump harder to supply your stomach and intestines. Your blood pressure rises instead of falling. Your metabolism speeds up when it should be slowing down. Essentially, your cardiovascular system stays in daytime mode when it should be resting. The research backs this up, 28%. That is significant. There is another issue too. A study in the European Journal of Preventive Cardiology found a 28% higher risk of cardiovascular death among people who regularly ate their largest meal late in the evening. Lying down with a full stomach increases acid reflux. And research in the Journal of the American Heart Association shows that severe reflux can actually trigger irregular heart rhythms by stimulating the vagus nerve. So, what should you do instead? Simple adjustments. Save the heavier meals for lunch when your body has all day to process them. Try to finish eating at least 3 hours before bed. If you go to sleep at 10 p.m., finish dinner by 7. When possible, keep evening meals lighter. Lean protein, vegetables, moderate portions. If you get hungry later, a small snack is fine. A handful of almonds, a piece of fruit. Just avoid large portions close to bedtime. Easy change, real protection. Habit number 2, drinking lots of water right before bed. Now, let me be clear. I am not telling you to drink less water overall. I am talking about timing. Here is the problem. Hydration is important, especially after 60. Our thirst sensation naturally decreases as we age. When you drink a large amount of fluid right before sleep, you will likely wake up multiple times to use the bathroom. Doctors call this nocturia. A study in the Journal of the American Geriatric Society found that adults over 65 who wake up 2 or more times at night to urinate have significantly higher rates of falls. And according to the CDC, falls are the leading cause of injury death in adults over 65. Here is why this is so dangerous. Each time you wake up and get out of bed in the dark, several things happen. Your coordination is impaired because you are half asleep. Your blood pressure, which was low during sleep, suddenly spikes as you stand. In dim lighting, with slower reflexes, the risk of tripping is high. One fall can lead to a hip fracture, surgery, blood clots, and a cascade of complications. I have seen it too many times, so what is the solution? That gives your body time to process it before bed. After 7, small sips are fine if you are thirsty. Use the bathroom right before lying down. Have your last large glass of water by 7 p.m. And please, if you haven't already, put night lights along the path from your bedroom to the bathroom. This simple step has been shown to significantly reduce fall risk. Small changes, big protection. Habit number 3, taking anti-inflammatory pain medications on an empty stomach before bed. I am talking about ibuprofen, naproxen, aspirin. These drugs are incredibly useful for pain and inflammation. The medications many people know as Advil, Motrin, or Aleve. Many people rely on them for arthritis, back pain, and headaches. But they come with risks that increase significantly after age 60. Here is what happens. This reduces pain, but it also reduces the protective mucus lining of your stomach. These medications, called NSAIDs, work by blocking certain enzymes. This reduces pain, but it also reduces the protective mucus lining of your stomach. When you take these pills on an empty stomach at night, the medication sits in direct contact with unprotected stomach tissue for hours while you sleep. Over time, this can cause erosions, ulcers, and in serious cases, internal bleeding. The statistics are sobering, 4 times higher, and this bleeding can develop slowly, without dramatic symptoms, until it becomes serious. So what should you do? Research in the American Journal of Gastroenterology found that adults over 60 who regularly use NSAIDs have approximately 4 times the risk of serious gastrointestinal complications compared to younger adults. First, always take these medications with food. Even a small snack provides protection. Crackers, a piece of bread, a banana, anything helps. Second, use the lowest effective dose for the shortest time needed. Third, talk to your doctor about alternatives. There may be better options for your situation. And never combine multiple NSAIDs without medical guidance. This dramatically increases risk. Protect your stomach. It is easier than you think. Acetaminophen, which is Tylenol, doesn't have the same stomach risks. Topical anti-inflammatory creams work locally. Habit number 4, sleeping flat on your back with multiple pillows. I know this might seem harmless. Many people have slept this way their whole lives. Let me explain what happens. But this position can significantly worsen a condition called sleep apnea, which is far more common after 60 than most people realize. When you lie flat on your back, gravity pulls your tongue and the soft tissues of your throat backward toward your airway. If you add multiple pillows that push your chin toward your chest, the airway narrows even more. During sleep, when muscles naturally relax, this can cause partial or complete blockage of your airway. That is sleep apnea. Each time your airway closes, then you stop breathing. Sometimes for 10, 20, even 30 seconds. Your oxygen drops. Your brain panics and triggers an emergency response. Your heart races, blood pressure spikes, stress hormones flood your system. Then you start breathing again, often without fully waking. The cardiovascular consequences are serious. If any of these sound familiar, please talk to your doctor about a sleep study. This can happen dozens or even hundreds of times per night. A landmark study from the Wisconsin Sleep Cohort, published in the New England Journal of Medicine, found that people with untreated moderate to severe sleep apnea had nearly 3 times the risk of developing hypertension. Research from Johns Hopkins showed that severe sleep apnea increases the risk of sudden cardiac death during sleep by 2.5 times. Yet the American Academy of Sleep Medicine estimates that 80% of cases in older adults remain undiagnosed. Warning signs include loud snoring, waking up gasping, morning headaches, extreme daytime fatigue despite sleeping enough, and blood pressure that is hard to control. In the meantime, try sleeping on your side instead of your back. Studies consistently show this reduces apnea episodes. Simple position change, significant benefit. Use one supportive pillow that keeps your neck in a neutral position, not flexed forward. If you tend to roll onto your back, put a pillow behind you to stay on your side. Habit number 5. This one is specifically for those who take blood pressure medication. And honestly, this might be the most important thing you learn today. Let me explain the science. Remember how I mentioned your blood pressure should dip at night? That nocturnal dipping is protective. The habit is taking your blood pressure medication in the morning when it might work better at night. But many people with hypertension have what is called non-dipping blood pressure. Their pressure stays elevated at night or even rises. This means the heart and blood vessels never get a proper rest. What they found was remarkable. Patients who took at least one blood pressure medication at bedtime instead of morning had a groundbreaking study called the Hygia chronotherapy trial, published in the European Heart Journal in 2020, followed over 19,000 patients for more than 6 years. 45% lower risk of cardiovascular death, 44% lower risk of heart attack, 49% lower risk of stroke. Same medication, same dose, just a different time. These are massive reductions. The reason? Bedtime dosing provides better blood pressure control during those critical nighttime hours, when cardiovascular events most often occur. Now, I must be clear about something important. Some medications work differently. Some people have specific reasons for morning dosing. Your doctor knows your individual situation, but I want you to be informed enough to have this conversation. Do not change your medication timing without talking to your doctor first. At your next appointment, ask, "Doctor, would taking my blood pressure medication at bedtime benefit me?" Research in the journal Circulation found that poor medication adherence is associated with 89% higher risk of cardiovascular death. The other critical point is medication consistency. Skipping doses is dangerous, so please take your medications as prescribed. Your medication is working hard to protect you. Help it do its job. Set a daily alarm. Use a pill organizer. Keep a backup supply so you never run out. Habit number 6, the last one, and in some ways, the most important. I know this can feel hard to control. Life is stressful. Worries don't disappear at bedtime. But I want to show you why this matters so much for your physical health. Going to bed in a state of stress, anger, or anxiety. Life is stressful. Worries do not disappear at bedtime. When you are stressed, angry, or anxious, your body activates the fight or flight response. Stress hormones like cortisol and adrenaline flood your system. Your heart rate increases. Blood pressure rises. Your blood becomes more prone to clotting. These are protective responses in the short term. But when you carry this stress into sleep, your body never fully shifts into rest and recovery mode. The research is clear. Low heart rate variability is a marker of cardiovascular risk. Instead of the calm, restorative state that should dominate during sleep, you remain in low-grade emergency mode all night. A study in the European Heart Journal found that people with high stress before bed had significantly reduced heart rate variability during sleep. Research from Harvard Medical School showed that anger episodes temporarily increase heart attack risk, and this effect is amplified when the anger persists at bedtime. A study from the Netherlands found that going to sleep angry actually impairs the brain's ability to regulate the emotion, making it harder to resolve the next day. So what can you do? Even agreeing to pause the discussion until morning can reduce emotional activation. Physical affection activates your calming nervous system. Second, practice a brief relaxation routine. The old advice to never go to bed angry has real science behind it. First, try to resolve conflicts before bed when possible. Say, "I love you." Give a hug. Physical affection activates your calming nervous system. Just 5 minutes of slow, deep breathing can measurably reduce cortisol and heart rate. Try this. Breathe in for 4 counts, hold for 7 counts, breathe out for 8 counts, repeat 4 times. Third, write it down. Research shows that spending 5 minutes writing your worries or making a to-do list significantly reduces cognitive arousal and improves sleep. Fourth, limit stressful content before bed. Switch to calmer activities in the hour before sleep. Your heart deserves peace at the end of every day, both the physical one and the emotional one. The news is designed to keep you engaged through stress. Switch to calmer activities in the hour before sleep. Your heart deserves peace at the end of every day, both the physical one and the emotional one. All right, let me put this all together for you. Here are the 6 habits we covered. 1, eating large meals too close to bedtime. Finish eating at least 3 hours before sleep. 2, drinking too much water right before bed. Last large glass by 7 p.m. 3, taking pain medications on an empty stomach. Always have a small snack with them. 4, sleeping flat on your back with multiple pillows. Try sleeping on your side with 1 pillow. 5, taking blood pressure medication only in the morning when bedtime might be better. Talk to your doctor about timing and never skip doses. 6, going to bed stressed or angry. Practice deep breathing, write down worries, make peace before sleep. These are not complicated changes. They are small adjustments that research shows can make a real difference. Let me give you a simple evening routine. 5 to 7 p.m. Finish dinner. Keep it lighter when possible. 7 p.m. Last large glass of water. Take any evening medications. 8 p.m. Start winding down. Turn off stressful news. Read, listen to music, talk with family. 9 p.m. Prepare your bedroom, comfortable temperature, night lights in place. 9:30 p.m. Bathroom, brush teeth, final medications. 10 p.m. Lie down on your side, 1 pillow, deep breaths. Make peace with the day. Studies suggest following a consistent heart-healthy evening routine can reduce cardiovascular risk by 40% or more. That is potentially years of extra healthy life from how you spend the few hours before sleep. Before I let you go, I want you to remember something. You are not too old to change. Your body is still capable of healing and thriving. Every night is a new opportunity to take better care of yourself. Tonight, pick just one thing from this video, maybe the nightlight, maybe eating dinner earlier, maybe 5 deep breaths before closing your eyes. Start small, build from there. You matter to your family. You matter to your friends. And honestly, after the time we have spent together, you matter to me too. I want you to wake up tomorrow feeling good. I want you to have many healthy mornings ahead of you. I put out new evidence-based videos every week for adults over 60. I read every one. Sleep well tonight, my friend. This is Dr. Michael Reynolds. Take care of yourself. If this was helpful, please subscribe. Leave a comment telling me which habit you will work on first. And share this with someone you love. You might help them without even knowing it.